Hey there and welcome. If you or someone you care about is about to start a new oral cancer medication, this guide is for you. We're going to walk through everything together, step by step, so you can feel confident and really in control of your treatment. All right, let's get into it.
Just think about that question for a second. What if you could fight cancer from home? This is the really powerful idea at the heart of oral cancer therapy. It's a huge shift, it moves treatment out of the clinic and, well, right into your hands, giving you a whole new level of freedom and involvement in your own care.
So what does this actually look like in real life? Well, on one side, you've got the traditional IV therapy. That means lots of trips to the clinic, really rigid schedules, and just tons of time spent away from home. But on the other side, you have oral therapy. That's medication you take right at home, which gives you so much more flexibility and control over your own day. It's a real game changer, but it also brings a new kind of responsibility.
Okay, let's start with the basics. In this first part, we're going to break down what these medications are exactly and the different ways they actually work to fight cancer.
To put it simply, oral cancer therapy is just powerful cancer-fighting medicine that you take by mouth, as a pill or a capsule. The incredible benefit here is getting to be treated at home. But it also means you're taking on a super important new role, managing your own medication schedule.
Now, these medications aren't all the same. They pretty much fall into three main buckets, and each one attacks cancer in a really unique way. You've got targeted therapy, oral chemotherapy, and hormone therapy. So let's take a look at each one, and we'll start with targeted therapy.
Think of targeted therapy as a smart bomb. It's designed to find and attack very specific parts of cancer cells. It's kind of like a key that only fits one particular lock. By blocking the signals that tell cancer cells to grow and divide, it can be crazy effective, and often with fewer side effects than traditional chemo, because for the most part, it leaves healthy cells alone.
Now, oral chemotherapy, it works a lot like the IV chemo you might have heard of. It's designed to kill any cell in the body that grows and divides quickly. Now, that's great for zapping cancer, but it also means it can affect some of your healthy, fast-growing cells too, like the ones in your hair or the lining of your mouth and stomach, and that's what leads to some of those classic chemo side effects.
And finally, there's hormone therapy. So for cancers that need certain hormones to grow, like some breast and prostate cancers, this therapy acts like a shield. It either lowers the amount of those hormones in your body or just flat out blocks them from getting to the cancer cells, basically cutting off their fuel supply.
Okay, now for the really practical stuff. This next section is so important. Taking these powerful medications the right way is absolutely essential for both your safety and for making sure your treatment actually works.
Let's go over the 4 golden rules. First, consistency is everything. Take the exact dose at the same time every single day. Second, listen to all the food instructions. They're there for a reason. Third, swallow your pills whole, unless your doctor or pharmacist specifically tells you not to. And fourth, this one is so crucial. If you miss a dose, never ever double up. Just take your next dose when it's scheduled.
Safe handling is all about protecting everyone in your house. Always wash your hands before and after you touch the medicine. If a family member or caregiver is helping you, they should wear gloves. And store your medication the right way, in its original bottle, tucked away from kids, pets, heat, and moisture. So the bathroom medicine cabinet is probably not the best spot.
All right, listen up, because this is a big one. You need to avoid grapefruit and grapefruit juice. It seems so harmless, right? But it can seriously interfere with how your body processes the medication, and that can lead to dangerously high levels in your system. This also goes for things like Seville oranges and pomelos. If you're ever in doubt, just ask your pharmacist. Your healthcare team needs to be your partner in this, which means you have to tell them about everything you take. I mean everything. Other prescriptions, over-the-counter stuff like aspirin, even vitamins. And you have to be extra careful with herbal supplements. A really common one, St. John's wort, can actually make your cancer medication less effective. Total honesty here is your best defense against a bad interaction.
So what's day-to-day life actually like on this kind of treatment? This section is all about managing side effects and, most importantly, staying on track with your medicine. The thing to remember is that side effects are almost always manageable, and being consistent, well, that's your superpower.
You can see here that for a lot of the common side effects, there are pretty simple and effective ways to manage them right at home. Feeling nauseous? Try small, frequent meals. Got diarrhea? Staying hydrated is key. Feeling wiped out? It's really important to plan for rest. And for skin rashes, a good, gentle moisturizer can make a huge difference. The most important thing is to tell your team about any side effects so they can help you out.
I really love this quote because it completely reframes your new role.
Yeah, the responsibility is on you. But that also means you are in the driver's seat. You're an active, essential part of your own care team. So don't think of it as a burden, think of it as a position of power.
So let this sink in for a second, because every single dose matters. This statistic, it's pretty stark, but it's so important to hear. Missing even 1 or 2 doses a month can be enough to let cancer cells regroup and start growing again. Sticking to your schedule isn't just a suggestion, it is the absolute foundation of your treatment success.
So how do you make sure you never miss a dose? You build a system. Use tools that work for you, like a weekly pill organizer or setting daily alarms on your phone. What's even better is linking it to a habit you already have, like brushing your teeth or having that first cup of coffee. Just find what works for you and make it your routine.
And finally, let's talk about your team. You are not going through this by yourself. Knowing who to call, and just as importantly, when to call them, is a critical part of your safety plan. This slide right here is one you might want to save, or even just snap a picture of with your phone. It clearly separates the real, true emergencies from other urgent issues. A fever over 104, trouble breathing, or bad chest pain. That means call 911 or get to the ER right away. For other serious issues like side effects you can't get under control, your first call should always be to your oncology team.
And here is your most important piece of homework. Find your oncologist's after-hours or emergency number right now. Go on, program it into your phone, write it on a sticky note for the fridge. Having that number where you can always find it will give you incredible peace of mind.
And please remember, there are amazing organizations out there ready to offer support, information, and even financial help. Don't ever hesitate to reach out to groups like the American Cancer Society or Cancer Care. And always, always ask your specialty pharmacy about copay assistance programs. They can often help bring your costs way down.
So what's the big takeaway here? It's that your treatment is a partnership. You are the most important person on the team, but you are supported by a whole crew of doctors, nurses, and pharmacists. You are not alone in this. You've got this, and there is a team right behind you every single step of the way.